the big thing that I have been touting all over social media for the last few weeks is early detection. Get your
Mm,
fucking mammograms. And they suck and they hurt, but that's 5 minutes and then you're done. And
yeah.
without early detection, you and I would have both been in a much more serious boat later on
Hmm.
when the tumors had grown and had been so invasive that they become big, ugly, scary, angry things. Um, Instead of small, tiny little angry things
Yeah.
that are almost equally scary, you know?
Yeah. And I was just on an NIH panel talking about, are we going to be able to use artificial intelligence in breast cancer treatment? I was the patient representative, and someone brought up this issue of false positives, which, if you're aware of, or listeners aware of, there's a lot of talk about, we screen women too much, we get all these false positives, it causes women anxiety. And I was saying, this is so paternalistic. You know what causes
Mm-hmm.
anxiety?
Having
Cancer.
cancer. Right.
and
Exactly.
and having a bigger tumor, because if you'd been screened 2 years ago, it would have been smaller, exactly what you're saying.
Yeah.
And then one of the physicians on the panel said, there are situations where we get so many false positives that ends up using up resources. And I said, okay, well, then that is what needs to be emphasized, not women's anxiety.
Right.
And, so if you're a woman and you're listening, or if you're a man and you're listening and you're thinking about your wife or your sister, whatever, just don't buy that argument. Screening is important.
Welcome to the Permission to Heal podcast. I am Marcy Brockman. Together, we will discover what brings us healing, meaning, and true joy. You only need your own permission to begin. Hello, everyone. I am so thrilled that you are here for Permission to Heal. I am Marcy Brockman, and today I have a conversation with Theresa Brown, Ph.D., RN, BSN. Theresa Brown is a nurse. She's a writer who lives in Pittsburgh, Pennsylvania. Her third book, called Healing: When a Nurse Becomes a Patient, was published in April of 2022. It explores her diagnosis of and treatment for breast cancer in the context of her own nursing work as an oncology nurse and a hospice nurse. Um, it explores all of the emotions and all of the treatment and everything in between that she underwent during her diagnosis and the treatment and the aftermath. It has, I just read it this week in the face of my own breast cancer diagnosis, and it really helped me articulate a lot of my own feelings and be a little less anxious and nervous, because Theresa and I have the same exact cancer that Theresa had. And she's fine. She also wrote a book called The Shift: One Nurse, 12 Hours, Four Patients' Lives. She has written for the New York Times, for CNN.com, the American Journal of Nursing. She has interviewed on NPR programs Here and Now and Fresh Air. She's appeared on Hardball and MSNBC Live. Her first book, Critical Care, chronicles her first year of nursing. She also has a PhD in English from the University of Chicago, and inspired by her kids, left academia to become a nurse, a career change that she has never regretted. In addition to those books, she also wrote a book called Everything in Between. No, that's wrong. All of her books are listed in the Permission to Heal bookshop on bookshop.org, and are available now anywhere books are sold. So I hope that you learn a lot about breast cancer and the American healthcare system, and how we fail as a country to take care of people and don't show them the compassion and empathy and kindness and patience that they deserve, that we all deserve. So it is Breast Cancer Awareness Month, at least for another week. And I have been talking about my breast cancer diagnosis all over social media since the beginning of October. My diagnosis came at the end of September. And my big quest in all of this is to urge all of you, every woman out there, to religiously go for your annual mammograms, because my cancer and Theresa Brown's tumor cancer were detected early through mammography and were not palpable, did not have physical symptoms. And if it wasn't for early detection, if it wasn't for repeated annual regular imaging, and I do recommend going to the same place every year so the same radiologist reads the images and they can be compared, because that's how mine was discovered. There was an asymmetry between last year's imaging and this year's imaging, which led them down the road of further diagnosis and imaging and testing and all of that stuff. So go get your boobs squished. It hurts. It's uncomfortable. It's annoying. Can be slightly embarrassing if you think about it too much, but do it anyway. It absolutely has a direct chance of saving your life. Thank you so much for being here. Hi, I'm so excited to share with you the new Permission to Heal Bookshop on bookshop.org. We all know how important it is to support our local and independent bookshops, and I've created a podcast dedicated bookshop on bookshop.org. So just follow along with me at Permission to Heal Bookshop on bookshop.org. The link will be attached to the post, and you can have access to the entire catalog of books by my expert guests. You can just click and order from the independent bookshops and support everyone. It's pretty awesome. I've also put a bookshelf with my own Permission to Land books on it, and all sorts of books for inspirational help and books that I love. So join me on bookshop.org with the bookshop, the Permission to Heal Bookshop. Hello, Theresa. I'm so stoked that you're here today. How are you?
Well, thank you. I'm good, and I am equally stoked. So
I don't know where that word came from. I never say stoked, but okay, it's here.
Sure. Yeah, it's apt. I think it's good. Yeah.
Yeah, it is apt. It is apt.
It's a bit of a throwback. It's good. Yeah.
So here we are at the end of October of 2022, and it is Breast Cancer Awareness Month, and you have written this book called Healing, When a Nurse Becomes a Patient. And I got up at 4 a.m. this morning before school because I'm an English teacher, and I finished reading the book before, because I wanted to, I like to read the books that the guests have written, so we can talk about them. And the book could not have been better timing for me. I was diagnosed with exactly the same breast cancer you had in
Wow.
the same breast.
Wow. Wow. I am so sorry. I mean, there's a lot more to say, but
Yeah. Yeah. There's a lot more
yeah.
to say, but it felt like to me, obviously shitty news.
Mm-hmm.
Obviously, no one wants to hear that. And I had 1,000 questions after the radiologist said what we thought was a benign something or other actually isn't. It is a small 8 millimeter tumor. It's very early, yada, yada, yada.
Right.
Um, but when I asked what the next step was, he had a wonderful breast surgeon that he recommends for his own family members, who's very highly regarded and had all the
Wow.
right fellowships and all the right education and was literally 10 miles from my house. So totally great.
Wow.
But I instantly knew somehow that I had to take all of this to social media. So from the receiving my diagnosis, I've been on social media making videos about how I feel and what I'm learning and how to navigate the process and so on.
Wow.
And then I thought, well, I need a breast cancer expert. And with a tiny little bit of Googling, I found your book and I found you. And I was like, holy shit, this is exactly what I need. I have to get Theresa.
Aw.
So you're here. Excellent, excellent, excellent. So the audience already heard your intro, but would you, tell us a little bit about yourself and your fabulousness?
Oh, well, thank you.
You're
And
welcome.
let me say too, I'm happy to jump into the breach. So yeah, I have been an oncology nurse and a home hospice nurse. And then 5 years ago, I was diagnosed with breast cancer. Like you're small, slow growing, and absolutely terrifying.
Mm-hmm.
Um, and it didn't help that I had worked with leukemia and lymphoma patients, bone marrow transplant patients. So really the sickest cancer patients at diagnosis
Right.
that can be found. And a lot of them don't do well, although the numbers are much better than they were when I started doing that work, which is fabulous. And so that was in my mind. Like I sort of had to do a mental readjustment where I
Sure.
realized, wow, this is a slow growing, very small, non-aggressive breast cancer.
Your outcomes aren't going to be anything like those other people's outcomes,
Right,
like your patient's
right.
outcomes. Right.
But also, why didn't any of the clinicians taking care of me tell me that? I mean,
Right.
no one said that to me. And so it was that experience of this lack of empathy and compassion that followed me all through my treatment, but also led me to reflect on times when I'd been a nurse and hadn't understood really very much at all what my patients were really going through
Right.
emotionally, and how small things that we would say, oh yeah, that was a glitch, their chemo didn't start on time. Now I understood, to the patient it's huge.
Yeah. Absolutely.
Yeah, because it feels like a failing, it's a breaking of trust. It induces an incredible amount of anxiety and wanting to understand and not being helped to understand, not being
Mm-hmm.
reassured. Or, reassurance isn't always appropriate, but with my diagnosis, it absolutely is. And nobody did that. So that's what led me to write the book, was that back and forth between what I went through and then what I suddenly saw was a familiar kind of missing of what my patients were going through when I
Right.
worked as a nurse.
Yeah. Yeah. You did a really great job. Put your PhD in literature, in English to good use
Oh,
in
thank
writing
you.
this book because, you really made the reader feel what you felt when you were working with patients who were, in the process of dying and their um, I forget the medical lingo, but their painkiller machine isn't working.
Oh, yeah, the PCA pump.
The
Yeah,
PCA
right,
pump's
right.
not working and you can't get the piece, and then there's all this red tape and all this, like, medical care for profit kind of overlay, and we lose humanity in the process, and people are so busy like pushing paper and counting dimes and worrying about the bottom line and the stockholders that they forget that there are human beings behind all of these charts. And that, was just in some cases in my life, I've seen and felt medical care like that. Luckily, so far, I'm going to knock a lot of wood right now. My current breast cancer treatment plan isn't going that way, which is a really good thing.
Yeah, that's wonderful. And it's funny, I got a few reactions to the book where people said, "Oh, my cancer care was amazing." Sort of like, "Why are you talking about this?" Which I found a really strange reaction, because
Yeah,
it seems pretty well known that a lot of people find their care lacking in humanity. And the question for me is, if your healthcare system can do it, why can't every place do it?
of course, we should have
Yeah.
universal health care for everybody so that
Yes.
the good experiences that the I would say some, maybe the majority, who the hell knows, that a good portion of us have had should be for everybody. It shouldn't be
Yes.
economically based or geographically based or employer based or whatever it is. You shouldn't have to worry about if you lose your job that you're going to lose your health care. If you switch companies and you're no longer working for that other company, that you shouldn't have to worry about any of those things.
Right. If you live in a small town and your local rural hospital has closed and now your nearest oncologist is a 2-hour drive, I mean, yeah,
Right.
all these things that leave people bereft. And
Mm-hmm.
in healing, I emphasize, when I went to radiation oncology, the leadership in that clinic must have decided, we want to care for our patients. It was so different from everywhere else I went.
Yeah, I felt that.
Yeah, they were
Yeah.
kind. They explained, very basic things. There was no, we have a 10-point patient appreciation program. No, it was just civility, clarity, explanations, respect.
Patience. Yeah.
Yeah, things that any place can do. And that radonc facility was in the same hospital where I got my mammogram, where there was no one there to schedule my biopsy, where, if people read the book, where I got
Yeah.
parked in the hallway after my diagnosis so that I was crying in front of all these other
Yeah.
women.
No one stopped to ask if you were okay. No one held your
Right,
hand. No one offered you a
right,
Kleenex. Nothing.
right.
And oh, by the way, the woman who needs to make this appointment left already.
Yeah,
Like,
right,
what the
right.
hell?
Yeah. And so even in this hospital, there's kind of this pocket of compassion.
Mm-hmm.
We talk about clinical excellence, and I think compassion needs to be part of that. They did it. I don't know why mammography on the third floor could not also pull that off.
Right. Same facility. That's amazing.
Yes,
That's
right.
amazing. Yeah, I got my diagnosis and I had no idea what to do. Like, there was 1,000 questions. Like, I have cancer? What the fuck does that mean? I've
Right.
got a
Yes.
cancerous tumor growing in my breast. I can't feel it. There's no lump. It's less than a centimeter and it's like right in the middle of the three-dimensional center of my breast.
Oh,
So
wow.
so even the breast surgeon, like eventually when I found one, just it was only detectable by the 3D mammography machine. Couldn't find it on the sonogram.
Wow.
Um, and so I had the radiologist on the phone, and he's like, "Yeah, I'm sorry, it's breast cancer. We thought it was benign, but it's not." And he says it's a very small, probably 5 to 8 millimeter lesion. It's not even a
Mm.
centimeter. I'm like, I don't even know what that means. Is a lesion a tumor? Is that the same thing? What's the next move? Like, I don't know what to. And he's like, okay, here's the name of a breast surgeon. She's very well regarded. She's got great education. I've recommended my own sister to her. Call her. So he said, I'm gonna call her ahead of time, so they're expecting your phone call. And
Wow.
I called and I got an appointment in 10 days, which felt
Wow.
to me like a very long time,
Yes.
but really wasn't. And then from her, she did an exam, she reviewed my imaging, she told me to get dressed, brought my husband into her office, and we sat at her desk And she wrote out and explained, must have been in there for an hour. She
Wow.
explained everything that was going to happen, what the tumor was, what the pathology report said, what it mean, that it's hormone receptive, which is a good thing. It's less than a centimeter, yada yada yada. It's mostly in the duct, but they're calling it invasive because it's infiltrating the wall of the duct and
Oh, that is
coming out.
exactly what I had. Yes,
Right, and
DCIS
coming
that becomes invasive. Yes.
right. And so she says we'll do a lumpectomy, we'll get out to clear margins, we'll do the sentinel node biopsy. She explained to me what that was. And then after that, we'll do the pathology of the tumor, make sure we'll figure out the oncotype is, which I'm still not sure what the hell that means, and test for suspicious cancer cells in the sentinel node. And if there aren't any, you're good to go. And if there are some, we're going to have to come back and test and maybe, remove some more lymph nodes. But they're not expecting lymphatic involvement at this point because it's so new. So I'm hoping that that's the way it's going to go.
Yeah, that sounds
She was
wonderful.
great.
That
And
sounds like the gold standard.
I started to cry. I had a list of questions that I was
Hmm.
looking over my pre-printed thing, and she answered every one of my questions and then some. Um, and she actually
Yeah.
reached across the desk and put her hand on my hand and she said, "It's okay. Breathe. We'll take as long as you need till you're comfortable."
Wow.
And I was like, what, did I just land on another planet? No doctor's ever said that to me.
Wow.
She recommended a radiation oncologist who literally had an office across the hall from her. So she said,
Wow.
my office is going to call her office, and then her office will call you to set up an appointment. And the next day they called. I had an appointment for that following Friday. Like it was crazy. And then she'd suggest I have very large boobs. I wear a G-cupped bra and my back
Oh my
always
gosh.
hurts. Yeah, it's for oh my gosh, that's it for sure.
Yeah.
Um and so she suggested that I coordinate a breast reduction at the same time.
Oh wow.
And I at first I was like, what? Like it didn't even occur to me that that was an option. I'd never even considered
Yeah.
it. And I thought about it for a few days and I called her office and she set me up with an appointment with an amazing plastic surgeon who I fell in love with. My husband went with me. We both love him. And so November 16th, they're doing the lumpectomy, they're doing the sentinel node biopsy, and they're doing a breast reduction
Oh
all in one big fell swoop.
wow.
And
That's
then both of their support offices made all the pre-surgical and post-surgical appointments for me. I didn't have to do anything. I answered the phone, I took all the dates down, and now I just show up.
oh my gosh. I'm having such healthcare envy right now.
I was like shocked. Like I've never had to do when I was getting my hysterectomy 3 years ago, I was the one that had to go hunting for second opinions and figure out all this other stuff. And it wasn't as complicated as this, obviously, but I don't know. And then I read your book and I wanted to hug you. I felt so bad about how you were treated and having to put all of these pieces together yourself and the
Oh,
trauma of trying to
thanks.
figure out how to recalibrate your own sense of what your cancer was compared to your patient's cancer. Like I just felt that palpably through your book. It was
Yeah, and I mean, the other thing is people thought, well, because you're a nurse and you were an oncology nurse, you know what's going on. No, I mean, as I say in healing, that I forgot everything I'd ever learned about breast cancer. And I wasn't taking care of breast cancer patients, but this was not the forgetting of time, sort of like from
mm-hmm.
school. I forgot this was a kind of weird, my brain doing a block out kind of thing where I'm like,
Well, it's a different
what's
rabbit hole when you're a
yeah, like
patient.
what's staging? What's
Right.
hormone receptor positive? And so I was just like any other patient and needed that tender loving care that I am so happy to hear you are getting. That's
I'm excited.
yeah.
you know,
And I'll just say
that
as a
it's going well.
sidebar, yeah, I met another woman who had also a similar diagnosis to ours, who'd always had very large breasts, and she actually ended up getting a double mastectomy and found it so freeing, which
Wow.
I'm only bringing up just to say every woman's experience and every cancer patient's experience is going to be different. It's going to mean different things.
Yeah.
Yeah. I mean, I'm sure she's unusual and finding a.
Well, yeah. I mean, my doctor was even suggesting as an option doing a prophylactic mastectomy on because we don't know what, at that point we didn't know what my genetic history was. I mean, there was no history of breast cancer in my family on either side of my family at all. I'm the first person. Yay.
Yeah.
Always the trendsetter.
Yes.
But so we did the genetics testing and all of those markers, all of the, genetic mutations that would make an increase the predilection for getting breast cancer at all or again aren't there. So there was no reason to go that far,
Yay, yeah.
So.
Same. I mean, even though I have a pretty extensive family history on my mother's side, my mother didn't have breast cancer. My grandmother did, and several aunts. But once I got my genetic results, which were also negative, I decided I don't want to get a prophylactic mastectomy.
No.
But again, there are women who choose that, and it's interesting that I felt like my surgeon was really good at talking about at those options, but the kind of let's sit down and make sure you understand all of this, not as good at. And he was a really good surgeon. I don't want to just put it on him. There were other clinicians who could have done that for me.
Yeah, absolutely. And what I've learned since my diagnosis is that most new cases of breast cancer occur without any genetic component.
Oh, wow. Okay.
Because I was really under the impression that because I didn't think I had any of the BRCA genes, that it meant that I was not going to get breast cancer. Like I thought it was like a get out of jail free card, But 1 in 8 women, I'm looking at the statistics right now, 1 in 8 women, which is about 13%, will develop invasive breast cancer over their lifetime.
Right.
And 2,700 new cases of breast cancer are expected to be diagnosed in men in 2022.
Oh my gosh. Wow.
And that the lifetime risk of breast cancer for men is about 1 in 833. So it's much less prevalent, but it still happens.
Yeah, I know. And it must be so hard to disclose that, to talk about it, because it's also usually men, much older men, right?
I would imagine.
And I just sort of that generation, you're 70 and you get diagnosed with breast cancer. It must be so difficult.
Yeah. So emasculating,
Yes. I mean, it shouldn't be that way, but I'm sure it is.
But it probably is.
Yeah, I'm sure it is. I'm sure you're right.
Men aren't doing, for years, decades, they've been telling us to do self-breast exams. And when you get to be a certain age, you start your annual mammography. But they don't tell men any of that, So how they would even find breast cancer in a man is beyond me, unless he feels something because it's so egregiously big. I don't know.
That's it, right. Or has leaking from a nipple or something. That's a really good point. And I was getting back to what you're saying about genetic cancer. I mean, genetic risk and the kind of cancer you get. Because I said to my surgeon, well, I can't have a BRCA mutation, right? Because those cancers are always really aggressive. Mm-hmm. And he said, no, that's not right. And I said, oh, fuck.
Yeah.
And he said, oh, just lay it all out there. I'm like, come on, we're talking about breast cancer, There's got to be a room for.
Got to be a room, right.
For the F-bomb. Because that was absolutely. That's what I was telling myself. Like, oh, it's small, slow growing. There's no way I can have a BRCA mutation. And I mean, everyone comes up with these things to comfort yourself.
Right. To mitigate risk in your own mind.
Right. Right. Like me telling myself, yeah, I was diagnosed pre-menopause, but I was really close to menopause. Like that doesn't matter.
No. If you're still getting your period, you're still getting your period. Right.
Right. And it's still pre-menopausal, which is slightly higher risk of recurrence. But, this is also why physicians and nurses need to take time to really talk with people, because
there's so much misinformation out there, and so
yes,
many things get sort of cross explained, that you don't really know really what's going on. And like you said, everybody's cancer experience is unique, and there are a bazillion different permutations that this can present. So, what applies to a specific person's specific case may be very different than someone else's experience.
exactly. Right. And I had a lot of issues with tamoxifen, the drug that women take after they've had the active treatment.
Right.
And then I found out that some statistics are as high as 50% of women don't take it for 5 years. That's a recommendation. You take it for 5 years.
Right.
My doctor never said anything like that to me. She just kept sort of aggressively making sure I was still taking it, which I found sort of infantilizing. Like, I would
Well, you
tell
had
you if I'd stopped taking
yeah,
it.
and you had lots of exhaustion and brain fog and aches and
Yes.
pains and all sorts of things because of the tamoxifen. And
Right. And, half of women are great on it. It means nothing to them. That's wonderful. But for
right.
the other half, you've got to present honestly what people might feel, and hey, what's the risk benefit here? And
Yeah.
yeah, but I'm
So
so
as a postmenopausal woman, because I had a hysterectomy 3 years ago, they wouldn't put me on tamoxifen, right? They would put you on the drug that you're on now. I forget what that's called.
Arimidex, which actually I also stopped taking because I had problems with that too.
Oh, okay.
I would guess they would put you on Arimidex, but if you're postmenopausal, you can still take tamoxifen. Although Arimidex is the recommended drug, but if you're premenopausal, you can only take tamoxifen.
Okay.
I mean, there is at least one variant, but it's basically the same drug. It's not like with SSRIs like Prozac and Effexor. They're all kind of slightly different drugs. So
Sure.
one may cause problems for one person, another may be great.
Right.
These drugs, even when there are different versions of them, basically the side effect profile is the same. That's my understanding. I mean,
Yeah.
and
Well, it makes sense.
I'm only saying that because the science is changing all the time. And that's another thing people should know, that, you might read an article that's 5 years old, and so
It
many
might,
things in it might
yeah,
be completely out of
outdated.
date.
Yeah.
And yet, if you don't have the expertise to read research articles, not that I even am necessarily recommending that.
Just make sure that the sites that you're looking at or the
Right.
information that you're looking at is as up to date as possible and from
Yes.
reputable places like the CDC or the National Cancer Foundation or something,
Yes.
or something really reputable and not some random thing from 8
Right.
years ago.
Right.
Who the hell knows?
Yeah, right.
It's craziness. It's craziness.
Yeah,
So,
Nurse Brown's breast cancer website. Yeah.
right. But the big thing that I have been touting all over social media for the last few weeks is early detection. Get your fucking mammograms. And they suck and they hurt, but that's 5 minutes and then you're done. And
Yeah.
without early detection, you and I would have both been in a much more serious boat later on, when the tumors had grown and had been so invasive that they become big, ugly, scary, angry things, instead of small, tiny little angry things that are almost equally scary.
Yeah, and I was just on an NIH panel talking about, are we going to be able to use artificial intelligence in breast cancer treatment? I was the patient representative, and someone brought up this issue of false positives, which, if you're aware of, or listeners aware of, there's a lot of talk about, we screen women too much, we get all these false positives, it causes women anxiety. And I was saying, this is so paternalistic. You know what causes anxiety?
Having
Cancer.
cancer. Right. Exactly.
And having a bigger tumor, because, if you'd been screened 2 years ago, it would have been smaller, exactly what you're saying.
Yeah.
And then one of the physicians on the panel said, there are situations where we get so many false positives, it ends up using up resources. And I said, okay, well, then that is what needs to be emphasized, not women's anxiety.
Right.
And, so if you're a woman and you're listening, or if you're a man and you're listening and you're thinking about your wife or your sister, whatever, just don't buy that argument. Screening is important. And if there are issues with screening as, quote, using up resources because of false positives, that's a screening issue. That's an issue with technique and the science being applied. Don't
But
don't
wouldn't you
skip it
want
just
false
because of that.
positives and then have to do more testing? Like each one of those false positives is a life that doesn't
Right.
have cancer,
Right.
So
And
if we have the resource and it's meant to treat humans with or without disease, how is it a waste?
Right.
I don't
and
see it as a waste. What are you going to do? Leave them on the shelf collecting dust and not use them?
Right. And why is it breast cancer that this gets talked about the most? That's what I don't understand either.
Right.
Yeah, it's a life. You're right.
Why not prostate screenings?
Right. Or, now they're encouraging everyone to get a lung cancer screening. If you ever smoked, get a lung cancer screening. I mean,
Right.
I don't know the science well enough to know if that's a good idea or not, but there's going to be a lot of false positives then too.
Right. I think it's just the nature of medical testing,
Right.
You just have to do repeat imaging or repeat testing and have really expert people reading the images or the tests or whatever they are, and you move forward.
Right. So I agree with you. Yes.
What's
Get
the
your
answer?
mammogram.
To not test at all and then have everyone die of end stage 4 cancer, and then we need a lot more hospice nurses. Like either way, we're gonna have issues. So why not, while we can save lives rather than...
Right. That's a great point too. And like you said, you've had a biopsy that was benign. I've had biopsies that were benign. I'm not sorry that
No,
happened.
I was stressed for that short period of time.
Right.
And then jubilant that it was fine.
Right. Right. And I felt like, wow, someone's really looking out for me. They're trying to make sure that I'm not going to die of breast cancer.
Exactly.
Yes.
Exactly.
So even if it's you'll, a false positive is a fabulous result. I would love to have had a false positive. So.
Right? Let's throw a damn party.
Yeah, right.
So I know you wrote in your book about having all sorts of feelings and crying and sort of having trouble managing all of your own internal monologue while you were trying to navigate, do I work, do I not work, what my kids doing, what's my husband doing, there's like a whole lot of stuff that you have to sort of figure out. And I, like, right now I'm doing really well. I'm having this nice conversation with you, but I had a really shitty day, and I got these moments where all I think about is the surgery. Are they going to get everything? Are they going to get to clean margins? Are my lymph nodes going to be clear? Will they discover that I need chemo, even though that's not the plan right now?
Right.
What will the pain be like afterwards? Because they're doing a whole breast reduction and a breast lift. So it's a huge amount of,
that's true,
stuff going on there. And I don't know. There's just I really feel like we have a good plan, but there are so many unknowns still that when I allow myself to start thinking about all the things that I don't know, my chest gets tight and I find it hard to breathe. And I know that that's normal. I want to normalize that for anybody who's listening, that if you are not a little fucking freaked out about this, if this is your diagnosis too, if you're not a little fucking freaked out, I think you should be concerned.
Yeah.
I think it's normal to run the gamut of emotions every day.
In
the throes of this,
Yeah, and I have a good friend who's a breast surgeon who research suggests you should not have your friend be your surgeon.
No, too close.
Yeah, but I was talking to him one day and said, I've just been having wine and French fries for dinner. There was this restaurant a block from our house that serves these Belgian free, these, oh, they're like the best French fries ever, but they're Belgian. So,
They're
it
Belgian fries.
sounds really cool. But yeah, so there was a point where, at least once a week I would have wine and French fries for dinner. And
Sounds
then
good.
then I would go and also get this Chinese noodle soup at our local noodle place. And those things really helped me because I had the same, I talk about going for a walk in the park with my husband, go for a walk, be in the park, it'll help you feel better. Which did work somewhat, but I just started thinking about, oh my God, 5 years, I had 5 years stuck in my head. In 5 years, what age will my kids be? And I'm walking in this park in Pittsburgh and suddenly just start crying.
Yeah.
So I hear you. It is, I mean, I don't think roller coaster even accurately describes it. It's very, very emotionally difficult.
Mm-hmm. How did you,
Yeah.
besides the exercise, which I know you wrote quite
Mm-hmm.
extensively about in your book, what other kinds of self-care practices did you find worked for you or do currently still work for you?
Yeah, this is going to sound like a weird answer, but for me, taking a leave from my work
Mm-hmm.
was probably the most important thing I did because I was working as a home hospice nurse and I just felt like I was not going to be able to see cancer
Oh,
patients who were dying
yeah.
and do a good job. Or else I would do a good job and I would fall apart afterwards.
Mm-hmm.
It just seemed too hard. And so as I write about, part of me felt like, wow, I'm really failing. Why aren't I tough enough to do this?
Because you're
And
human,
yeah, I
Theresa.
know. And I mean, we saw so much of that during COVID, right?
Right.
Like we're not superheroes, but yes, because I'm human. And it took me a while to accept this is okay.
Mm-hmm.
Take a break, you know, it's time for you to be cared for and you can go back to that.
Absolutely.
um so yeah, if you can afford it, which we could, if you're able to come back to your job, whatever you need to do to give yourself space. And for some women, they want to keep working,
It's a
you know.
distraction. It makes them feel productive, like
Right.
cancer hasn't won. Yeah, I
Right,
could see
right.
that.
So it's I just have the most compassion for women who have to keep working,
Right. There is no
whether they
choice.
want to or not. But so again, there's no one right answer. Um, I'm sure I'm sure there are oncologists who would say wine and French fries is not the thing to eat when you have cancer. And like, so what? That's what I did,
Right. Every now and then, it's not the mainstay of your nutritional,
Right.
but every now and then, it's you have to give in to that.
Exactly.
Yeah.
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 So I tried to feel my feelings, and I also read a lot of Agatha Christie novels,
Oh, good.
which actually didn't make their way into healing, which is kind of interesting. But I mean, I'm not a huge mystery fan, but somehow I bought one, and it was just kind of perfect because it's like there's a mystery, so you can kind of think about that. But everyone still has tea. Nobody really gets upset about anything,
Right.
and
Right. Right. I've
and
had
maybe
a couple of really stressful years, as most of us have, and
yes,
between the pandemic and what's going on politically in the country and the divisiveness and everything else. And I'm a teacher,
yes.
so I've been like on the teaching side of all of this COVID nonsense and whatever. I was so stressed and so anxious as the school year was ending that I spent the summer hibernating. Normally, I mean, I was also in graduate school again. I'm getting a third master's and becoming a mental health counselor.
Oh, wow.
Um, so
Congratulations.
thank you. So that's my retirement plan. I figure by the time I retire from teaching, I will have finished all the coursework and the licensing stuff to actually be a counselor.
Wow.
So I was doing graduate classes all summer. So it's not like I wasn't doing anything, but I discovered that I fell in love with Regency romance novels.
Oh, wow.
And I read 27 Regency romance novels over the summer. And it was, sometimes I'd lay in bed for 4, 5, 6 hours at a time and just read. And it was like little mini vacations. I didn't have to be in my body or in my life at
Mm.
all. I could just go back, and I figured out that that's really part of my sanity routine.
No, I hear you. Yeah. I mean, and yeah, whatever,
Whatever floats your boat.
yeah, whatever works for you is, as long as it doesn't hurt anyone else.
Exactly. Exactly.
Yeah.
Exactly. So, so you have a newsletter,
Yes.
the Healing Newsletter.
Hmm.
How do people, what is it about? How do people find it?
It's on Substack. So if you go substack.com and look for the Healing Newsletter, it'll come up. If you put in my name, it will also come up, and comes out every 2 weeks. And to be honest, I'm still figuring that out, what it is. But what it is
Is it
now,
new?
it's pretty new. Yeah. So the book came out in April, and I started it a little bit before the book came out.
Okay.
So before and after the book came out, I was a lot writing about the book and where I was going to be. And now I've transitioned it into writing about healthcare, writing somewhat about what's going on with me and my health, but also thinking about what's going on in healthcare, what to say about that. Um, and people seem to like it. It's free. If
Cool.
you subscribe, you can always unsubscribe. And if people want to know more about me, they can find me at theresabrownrn.com. And one thing I'll offer is, if people are reading healing in their book group, I'm happy to zoom in, and I actually have book plates I can sign
Ooh.
and mail to you. And I've done that, and I really, really enjoy it. I love getting the chance to talk with other people about not just what they thought about the book, but what's going on with them in terms of
Mm-hmm.
healthcare. What are their thoughts about some of these issues? I mean, I'm
That's
now
really
in a
awesome.
position, yeah, where I talk about myself, but I'm actually more of a listening person than a talking person.
Okay. Well, it makes
So
sense.
I do really like learning from other people and hearing about their experiences. So if you go to my website, you can find out how to send me a message, say,
Okay.
come to my book group. Someone else contacted me over Instagram, which also works.
Nice. Yeah, I'm going to have all of the links to all of these
Oh,
things in the
great.
show notes. So, and all of the books that you have written are already available on the Permission to Heal Bookshop on bookshop.org. So,
Oh, nice.
if
Oh,
people,
thank you.
sure, sure. So if people want to pick up a copy, and I'm assuming that they will because it was great, and perfectly timed for me. Uh,
Yeah.
you can pick up the book. That will be really great. And you can support local and independent bookstores while you're doing it. So
That sounds wonderful.
why not do that?
Yeah.
So I always end each interview with the 7 quick questions as of this season. Are you ready?
Hmm.
Okay. What 6 words would you use to describe yourself?
Yeah, gosh, I saw that. Here's what two I thought of: patient and also impatient.
Okay. It works.
uh Patient, impatient, uh hardworking, listening. I don't think I can come up with six. Kind.
Mm-hmm.
uh
Intelligent, compassionate.
there you go. Very good, thank you.
You're
Thanks for the
welcome.
assist.
Sure. What's your favorite way to spend a day?
Wow, I would say being outside. Maybe I'm going for a great hike, maybe I'm reading a great book, and I've
Definitely
got some
outdoors.
tea.
Yeah, you're
Yeah.
an outdoor girl for sure.
Yeah.
Yeah. What's your favorite childhood memory?
My pony. I had a, not because I was an heiress, but because I grew up in southern Missouri,
Mm-hmm.
and my parents got me this mean old Shetland pony that I loved.
It was mean?
Yeah, I think all Shetland ponies are kind of mean.
Oh, I don't know anything idea. No, 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 I don't know anything about horses, so.
Yeah, that's okay.
Did you
I still loved it. Yeah.
What was the name of the horse?
It had different names, but I decided that ultimate name should be Sebastian.
Ooh,
I thought that was a very sophisticated name,
yeah.
when I was 8. Yeah.
Yeah, it sounds good. Sounds
Yeah.
appropriate.
Yeah.
What's your favorite meal
Well,
besides
obviously
French
wine
fries
and
and
French
wine?
fries. Yeah.
Nice. Anything else besides wine and French fries? Belgian French fries?
Oh, any kind of, like, I make this pasta pomodoro with this like long simmering tomato sauce. Any
Ooh,
recipe that kind of has a zen to it. A chicken noodle soup can be the same.
sure.
I also love a good BLT, which happens to be my initials backwards. So
Oh, that's cool.
yeah.
That's awesome. What one piece of advice would you like to give your younger self?
Don't think you have to know everything. I mean, don't think you have to have the answer. Life will unfold.
That it's okay to say you don't know.
Yeah. And to make a
Absolutely.
plan and have it change.
Because it's gonna anyway, so you might as well get used to
Exactly.
it.
Yes. Yes.
Yes. What is the one thing you would most like to change about the world?
Oh, I wish people would be more kind
Mm-hmm.
and that we had universal health care. But
Yeah, I knew that was going to be part of it. I was
yeah,
just waiting.
of
I was
course.
just
Yeah.
waiting. Yeah, I think that any business, I can't even use the word business. I think that anything that involves the care of humans should not be for profit.
Yes. I 100% agree with you.
Whether it's healthcare or it's education, anything where human beings, which are an unpredictable, unquantifiable quotient. You can't put a bottom line on compassion. You can't put a bottom line on whether a student learns something in a certain period of time.
Right.
You can't make these things for profit without losing the fundamental unknown or the fundamental quality of the person and the relationship that makes either the healthcare or the education happen. I don't know if I said
Yeah,
that clearly.
you
Um,
did. I think that's actually quite brilliant. Yeah, because people are unpredictable. Their needs cannot always be pinned down in an easy way. They can't always be categorized
no.
easily.
And like your patient who needed an extra fentanyl patch in the middle of the night,
Right.
you shouldn't have to go through 14 layers of bureaucracy to get a person who is going to die in a matter of days the pain medication that he needs to leave life in a dignified way and
Right.
to not be tortured until the end.
Right.
And that may have cost that company a few extra bucks, but tough shit. If that bothers you, don't be in that business.
Right. Right. Yes.
You know, like
Yes.
it makes me so angry. I hear about, since forever as an educator, I've been hearing about, I know this is a little bit of a tangent, but my audience is probably used to it by now. Um, I've been hearing about, that charter schools
Mm-hmm.
take away taxpayer money from the public schools. And so that school choice, yada, 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 actually takes away from the quality of education that the school, a public school, can provide for its pupils.
Mm-hmm.
And they don't have to adhere to the same standards, quality, um, um, skills, of
Right.
anything. So, I mean, I just heard a story the other day about a young person who grew up in Utah who graduated high school from a charter school that was basically like kindergarten. Here's your high school diploma for doing absolutely nothing.
Wow.
And how
Wow.
how is that a benefit to anybody? It's not a benefit to that kid. It's not a benefit
Mm-mm.
to the society for that entire kid's life. All of those interactions that kid has, he's not going to have what I think the United States likes to think is the common or acceptable standard for high school public education in America. You
Right.
know?
And it's at some level it's unpatriotic. We are talking about, well, we have to compete in a global economy and we need workers who can do blah, 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 blah. And yet we're not willing to invest in public education.
No.
I mean, that just doesn't make any sense. And by the same token, there was just a report that came out from the Commonwealth Fund saying American life expectancy is shorter than in other countries that have universal health care. So they spend less money. The life expectancy of their citizens is longer. And I feel like this is
get better
important.
quality health care
Yeah,
throughout
this
their
is
lifetime.
important. Like, you are not going to live as long if you live in the United States and are using American health care.
Yeah. Yeah.
I mean,
My dad and my stepmom, a bunch of years ago, they used to be world travelers. And I guess maybe 5-6 years ago, took a trip to Iceland. And my dad occasionally had these episodes, these neurological memory lapses. I guess the precursors to the Alzheimer's he has now.
Oh, wow. Sorry. Yeah.
Yeah. Again, it is what it is. Nothing you can do about it but accept it and figure out how to carry on. But he was in Iceland and had one of these episodes. And the tour guide brought them to a hospital. And within 2 hours, he had been triaged. He had seen the ER person. He had seen a neurologist.
Wow.
They gave him an MRI, communicated with his neurologist in New York, and there was no charge.
Wow. Wow.
And they were like, we have to give you some money. Like, it has to cost something. No, doesn't cost anything. Universal health care. This is what it is. You're a visitor in our country. We don't want you to get sick here. Here you go. What the fuck is that? Why can't we? They could do that in Iceland. Why can't we do that here?
Right.
Really?
It's true.
And so here he comes back and he has to call and make an appointment and he has to wait to see the neurologist. And then it's another appointment and another wait to go see the MRI, to get the MRI. And then another wait to have that read and have the report sent back to the neurologist. And then another visit to the neurologist to go get the report explained. And then the treatment. And each time, each step, there's a wait, there's more phone calls, there's more anxiety, and there are more copays.
Right.
It doesn't make any sense whatsoever.
And you start to just hear the ka-ching.
Yeah.
I mean, I am not by nature a cynical person, but I feel so cynical about our healthcare for exactly all those things that you're describing. Even the follow-ups, they had me every 3 months doing a follow-up with a doctor and, to be seen and get a breast exam. And was what, a $40 copay. And I have really good health insurance.
Right.
And I just started to feel like, is this for the copays? I mean, what are they doing? Finally, I said to my doctor, why do I have all these appointments? Like this.
Is it important to check up every 3 months post lumpectomy?
I mean, right. And my tumor, like yours, was only found through a scan. It wasn't found through an exam. What is the point? And my husband said, there's a cost to you having to do these visits because it was like a revisiting of everything that I felt failed me, the whole human side failing while I was getting treatment. Right. And so I was able to cut them back. And now I'm at 5 years and I'm clear.
Yay! Yeah. Congratulations.
Thank you. So I don't have to keep doing them. But a friend who was diagnosed about 6 months before me didn't have any kind of follow-up like that. Same healthcare systems, So I'm like, was it just because my insurance would cover them? And that it's crazy. Just that the standards are based on what will your insurance company pay for.
It's ridiculous.
Yeah, it is.
And then because of somebody else's greed, you're then re-traumatized over and over again as you keep going to these appointments. So it's costing you money and it's costing your soul.
Right.
each
And
time that you show up, you
right.
know?
Peace of mind
Yeah,
and everything. Yeah. Just
that's crappy.
it
Sorry.
is. It is
But you're 5
crappy.
years.
Yes.
So now what? You're just back to the annual mammogram thing again?
Yes.
Okay.
Yeah. Um, yeah. And I really hoped when I got the news it's clear and that I would just feel like, whew, okay, cancer, we're done. Um, I don't feel that way. I am starting to feel more relaxed, but it took a while. So
Mm-hmm.
people are listening, it's hard. It's hard to get beyond that fear. And I'm not sure you ever get totally beyond it.
Well, you just
But
felt like there was another shoe that was going to drop kind of thing?
yeah, or just, yeah, just kind of the waiting,
Mm-hmm.
you know. So, just be easy on yourselves.
Yeah.
I would like to say, wherever you are in the status of breast cancer, just be easy on yourself. It's hard.
Or any mental health trauma or any physical
Right.
health trauma. I think that should be our mantra. Always self compassion and be easy on ourselves. Say
Yes.
to yourself what you would say to your most treasured love, your most treasured best friend.
That,
Whatever you
yes.
would give that person, you need to give to yourself.
Yeah, that is such great advice. It
Thank you.
really is. Yeah, it really is.
It only took 30 years of therapy to get there, but that's okay. Okay, the last one of these 7 quick questions, which turned out not to be quick at all,
That's okay.
is what TV shows are you binging right now? It's totally taking a left turn, but
Yeah, no, that's okay. I'm not binging anything right now, except, well, we did just binge this. This is going to make me sound well. My kids tease me all the time. This Icelandic
oh, there you go.
noir that was called Trapped. Now it's on Netflix and it's called Entrapped.
Okay.
We just binge watched the third season, but I think I binged so many things during COVID
Yeah.
that I've lost my taste for it
Mm-hmm.
a little bit. But maybe something good will come along. But it was fun to watch our Nordic noir. But our kids tease us. They're like, "What is that on Iceland TV?"
Nice, 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 nice.
They're like,
I
"Oh,
ha-
mom, we knew you would like this movie. It has subtitles."
You're not watching a movie, you're reading a movie.
Exactly.
Oh, funny. See, I like to do other things while I'm watching. So reading subtitles doesn't work for me because I'd like to hear it so that I can do other stuff. But
Well, and see, for us, we like subtitles because our dog watches with us and she has this pig that she squeezes that makes this really loud oinking noise.
oh, so
And
you
so,
need the subtitles so the
right,
pig doesn't obliterate the
we can have the
dialogue.
subtitles and she can play with her pig and we're all satisfied.
I love that. What kind of dog is she?
She's a shepherd mix. She's a rescue dog. She's a mutt, but she's
So are we
so
all.
so sweet. She's like a cat almost. She's so loving.
Wow.
Yeah.
Wow. That's awesome. Well, thank you so much, Theresa. This was healing in so many ways.
Aw,
What I did
yay.
there?
Yes. I love it. And I
um,
just want to say before we end,
yeah,
good luck to you.
thank you.
You will get through this. There will be hard times. But I'm glad you're in a health system that's looking out for you. That's wonderful.
Yeah, yeah. It used to be something that I thought was just ridiculous, like the overlay of like the big healthcare management umbrella. And it really bothered me that one by one, all of my doctors were going that direction. Instead of being their own
Mm,
practices, they were going underneath the umbrellas of these management companies. And I guess it's really the only way they can make money nowadays with the insurance companies the way they are. I don't know the reason, really. If that's not it, then I'm completely wrong. But um, I do find as a patient, it turned out that a lot of my doctors are now under the Northwell Health umbrella. And I like the fact that on my Northwell Health patient portal, all of my doctors can see all of my diagnoses and all of my paperwork and all of the blood work and all of the imaging and all of the results of everything. And then I don't have to re-explain the whole entire history of my entire life every single time.
Right. And see, that's the way it should work. Yeah. Like, I'm part of a big unified system, but I mean, in some ways what you're talking about happens, and in other ways it's just a mess.
Right.
But what you're talking, yes, that is the goal.
It's helpful.
Yes. Organization, standardization, one record. Yep.
Yeah.
It's great.
Excellent. Well, thank you so much, Theresa.
You're welcome.
I'm
Thanks for having me.
So thrilled that you were willing to give me an hour of your time.
Yeah, and let me know how you're doing. I'm interested.
I will.
Okay.
Thank you.
You're welcome.
Okay, don't leave.
Thank you for joining me for this episode of Permission to Heal. I hope you found it moving and inspirational. Please remember, you don't need anyone else's permission to trust and follow your heart. You have the power within you. Subscribe to Permission to Heal so you don't miss any new episodes, and please share this with your friends.